Thank you once again for joining this conversational webinar. It's entitled Decolonizing Humanitarian Education and Training in the Time of Trump. I hope everyone can hear me. My name is Chichi Undie, and I am a research director with the Baobab Research Program Consortium, led by the Population Council in collaboration with the Population Council Kenya and the African Population and Health Research Center. I also serve as a co-chair on the CHH Lancet Commission on conflict, health, and displacement. And I'm pleased to be moderating this particular webinar. And just for those of you who may not have received a brief description of it, this particular Lancet Commission is focusing on a variety of areas relevant to conflict and humanitarian settings. One of them happens to revolve around the issue of education and training and the future workforce. In the webinar of today, we really want to focus on the issue of decolonization as it relates to humanitarian education and training. In this era we find ourselves in, there really is a lot to unpack when it comes to decolonization, including, whether the conversation has totally been turned on its head with some of the recent developments in the world. I'm joined by a group of esteemed panelists whom I am going to introduce. Let me just stop sharing my screen here. I'm going to start out by introducing Sabina Faiz Rashid, who is a professor at the BRAC James P. Grant School of Public Health, BRAC University in Bangladesh. Sabina is also the Mushtaq Chowdhury Chair in Health and Poverty and the Director, Center of Excellence for Gender, Sexual and Reproductive Health and Rights at the same university. In addition to Sabina, and Sabina, let me not forget this important piece of information, she also happens to be a co-chair on this particular Lancet Commission. We are also joined by Nicholas Mida, who is a professor within the Department of Public Health, Health Sciences and Training Unit at Joseph Kizerbo University, where he also serves as the director for the Higher Institute of Population Sciences. This university is located in Burkina Faso. He holds an MD, a PhD, and an HDR, and with specialization in epidemiology and public health. He is also a commissioner on the CHH Lancet Commission. We're joined in addition by Alsan Bahatab, who's a postdoctoral fellow at the Center for Research and Training in Disaster Medicine, Humanitarian Aid, and Global Health in Italy. She also happens to be serving as a next generation scholar on the CHH Lancet Commission. And last but not least, as one of our panelists, we have Amarat Omar, who is a hub manager with the University of Geneva In-Zone program situated in Kakuma, Kenya. Having introduced everyone else, let me also introduce Anna Mateus, who is the executive editor of the Lancet, and who will be sharing a little bit about what a Lancet Commission is and why this particular one is important. Over to you, Anna.
Thank you so much, Chichi. So the aims of the Lancet are to use science as a lever for better health, equity, and justice, and also to generate knowledge for better patients and public outcomes, but also to promote research as a tool for accountability. So our vision is to provide a forum for research, practices, and policies that demonstrate the power of science to improve lives. And the Lancet Commissions represent an important format in this vision. So Lancet Commission is a scientific review, inquiry, and response to an urgent and perhaps neglected or understudied health predicament, which is science-led. It involves international collaborations and partnerships with a range of experts with different relevant backgrounds to define the scope of the problem, the causes, and potential solutions. It aims for impact and transformational change, and therefore it's specially focused on policy recommendations or political action. This commission is particularly timely and important to us Last year, a report by Peace Research Institute Oslo stated that 2023 saw the highest number of state-based conflicts since the Second World War. And also the world has experienced a further surge in conflicts in 2024. Also at the end of June last year, over 22 million people worldwide remain forcibly displaced. So as this commission has put it, the humanitarian system is overwhelmed and no longer fit for purpose. And now with the recent funding cuts by the Trump administration, the much needed reform can no longer be postponed. So at the Lancet, we are hoping that these brilliant groups of experts will that have joined this commission, and that includes people with different backgrounds and from different geographies, and with some commissioners having also lived experience. We are hoping they will reimagine the humanitarian aid system with a focus on health and provide bold, optimistic, and inspiring recommendations which challenge the existing systems and, importantly, put affected populations at the center. So, of course, this requires decolonization of humanitarian aid and education and training. So I'm very much looking forward to this discussion.
Thank you very much, Anna. And we're going to kick off. I see that we may have lost one of our panelists. She may be having technical difficulties. Let's see if she's able to join us in a few minutes. That's our son. But in the meantime, let me just share that we are once again referring to this as a quote unquote conversational webinar. We are going to be having 3 or 4 rounds of conversations about this particular issue. And I'd like to say to those of you who have joined us to please take note of the Q&A function at the bottom of your screen. Please feel free to put your questions in there as the conversations go along. We will have the panelists try to take a peep and begin to respond. In addition, we are reserving about hopefully 20 minutes or so for them to, respond verbally rather than just by typing their responses into the chat. So I'm going to start off with the first question around the issue of decolonization. And those of you here in the virtual room will agree with me that over time, quote unquote, decolonization has really become a term that we can't ignore. Not just in the humanitarian sector, but across sectors in general. And of course, what it means and how it plays out in each context is bound to be, different in some ways. We're focusing today on the humanitarian health system. And so the first question is, within this system, Sabina, we'll start out with you. Why is decolonization important? And what has worked in trying to operationalize this concept, which can be somewhat difficult to grasp? Please go ahead, Sabina, and then I'll ask Nicholas to add on to what you have to say.
Okay, good morning, good afternoon, good evening. Great to be here. Thanks, Chi-Chi, and respected panelists. I have a few comments, and I know we have a couple of minutes each. So first of all, the term decolonizing has been going around for quite a while. And the way I see it and the way I've embraced it, because I live and work in Bangladesh and have been for over 25 years, is that it is very important to understand that this is not a new term and it's not about the US or governments. It's really about a term that's been in action for the last, I would say, 4 or 5 years, where scholars, practitioners, activists have been actively engaging in what does this mean. For me, I see it at least in the School of Public Health, and we're based in South Asia, in Bangladesh, the BRAC School of Public Health, is that here's an ongoing opportunity to continue to contextualize what public health means, which is moving beyond a predominantly disease framework. And while public health and disease is important, because we're seeing the challenges before COVID, post-COVID, if we look at conflict, if we look at migration, we need to really kind of reclaim what public health means in different contexts. And in the Bangladesh context, which is similar to many parts in South Asia, but also countries in Africa, health is also social, economic, political. If you don't have a job, if you don't have food to eat, you can't have good health. And there's enough studies shown to show the interconnectedness of health with one's everyday sort of lived environment and experience. So if there's endemic poverty, there are challenges in public health. So here's an opportunity to reframe public health as it's being done. And I would say continue. Prioritize communities and practitioners is the way I understand decolonizing, because usually in development or in interventions or in research, even the tools we design is very top down. So from the methodology to the way we design and work in silos, there's a systematic kind of inclusion of communities as token, rather than communities co-developing and co-designing from research methods to understanding, training, and education. So if we're going to train, is there sufficient content that addresses communities and diverse communities, not homogenized into one category, and understand what their priorities and what their needs are and what public health is as a lived experience? So I'm going to leave that for now and then maybe add more later. Thank you.
Well, thank you so much, Sabina, for kicking us off. I'm going to sort of pick up on one of your phrases about how it's not really about the US. And I'm not sure if you would agree with that, Nicholas. Sabina's made some cogent points, including the fact that, we were talking about decolonizing before any of the recent policy directives within the US, which have sort of had a ripple effect on, other countries in the global north and certainly here in the global south, quote unquote. What is your perspective on this? Why decolonization is important and what you think has worked so far? Yes, Nicholas.
Thanks. Yes. You hear me?
Yes, we do.
Okay. Thanks for this question. Let me be more descriptive about this question by coining what coloniality is for us. And then I will consider, after this coloniality issue, decolonization, focus on humanitarian system, and decolonization of education and training. So coloniality for us resonates as white supremacy, white saviorism, global north supremacy over all interaction with global south, whether it is a question of knowledge production, practice, collaborative scientific research conducted in the global south, academic training in global health, even the definition of the global health agenda or the distribution of resources dedicated to development in the global south. For all these aspects, the actor of global north take hegemonic control of all the level of reflection, decision-making, and action. White ignorance of system, structure, and mechanics that perpetuate coloniality. So for me, decolonization is to eliminate coloniality, as I just described. Raise voice and express in all fora like this webinar all uncomfortable truths about global health and all development industry. I can refer to Berger's book last year, Reduce Systemic Inequality in North-South Interaction, Promote More Equitable Partnership, Allyship, Reengineering Whole Farmer Legacy, in calling upon the ethic of accompaniment in the humanitarian landscape. When it comes to decolonizing education and training in a humanitarian system, let me use Say Abimbola last paper in Health Policy and Planning called Unfair knowledge practice in global health. For me, Abimbola defined all the challenges. Those actors are credible in knowledge production. Those knowledge count. Those knowledge is prioritizes. Who design curricula? Who deliver training? Where are geographically institution, university, center, NGO, training network, and platform certification body? For him, all these actors are those who resist so that things remain as they are in coloniality. So in decolonized education and training in humanitarian system, I prefer that we take one by one all these questions and call upon equity in power dynamic, diversity of knowledge production actor, inclusion of local community, domestic and innovative finance, domestic and inclusion of local community, experiential knowledge, localization, fairness, allyship, accompaniment, and you will start the process of decolonization. Thanks.
Thanks a lot, Nicholas. A lot to digest there. But, in response to your questions about, who designs the curricula, whose voice counts, and so on and so forth, I think I'd like to bring Almarat in, at this juncture, because I think the in-zone program that you manage, Almarat, may have, some interesting responses to that question. So can you tell us about the in-zone program that's run in refugee camps around the world, including in Kakuma, Kenya? It's certainly an interesting example of decolonized training, quote unquote, perhaps. As a coordinator or manager at InZone, can you briefly describe that program for us and what makes it unique?
Yeah, thank you for having me, and I believe you guys are getting me clearly. So, yes, InZone program is a program of the University of Geneva. It is currently located in 3 refugee camps. I mean, the first one being the first and the oldest one, which is in Kakuma refugee camp, where I work. We have the other one, which is in Jordan, that is in the Azraq in Jordan, and then the new one, which was established recently in Niamey, that is in Niger. So, well, how the program works, there is always a physical hub in the refugee camp, and then this hub is actually entirely refugee-led. In this example, I'm the hub manager for the Kakuma program, and of course, we have other 3 academic coordinators that help around with managing students and also all the program. So the refugee leadership does not only manage, but it also advises the university and the program on the relevant programs for the hub. If there's any program that is being developed, these leaderships take part from the on-site, of course, incorporating the community perspective. And at times, we even have a strong opinion when a program is not really fitting in a context. In our context, we say, I mean, this one looks entirely out of this context, and it does not actually, it's not going to benefit the community in any way. So some of the programs we have, just to give you an example, of course, we have a Coursera program, which is a paid program at the university with over 15,000 courses. This is to give, I mean, refugees and what they call a good overview of courses for them to select remotely. But we also have a second course, which is community health, advanced certificate in community health, which is, of course, a pathway towards a degree. So this course is actually offered by the Faculty of Medicine of the University of Geneva. So the course was actually developed locally. Of course, the university took lead, but now locally it engaged ARC. Of course, it's an international organization, but it is one that is in charge of health in the camp. So and he knows, of course, the health situation in the camp. But also we had community health workers who were refugees, who actually as well took part in the development of this program. The program was developed in program of like 2 years before actually it was launched in 2022. So entirely as well taking the perception of the community to bring something that is relevant, because these community health workers are supposed to go work in this community. So I believe if they are trained on something that is not relevant to Kakuma, then they are not going to be contributing very well. So I think, yeah, that's how the hub functions. Yeah.
Thank you, Amarat. I mean, it's an interesting example of, I guess I would call it decolonized collaboration in a way. I'm sure there'll be some further questions and some probes on that as we go along. And I can't believe it's already 22 minutes past the hour. So I'm going to move us along to our next conversation round. I really want to go back to this issue. I mean, Nicola mentioned, I wrote this down. You talked about how there are some uncomfortable truths about global health that we have to, begin to face. It's hard to separate the decolonization conversation from the recent events in the US, which, as I mentioned earlier, they've had their impact on the rest of the world. I'd like to read an interesting excerpt that I stumbled upon in the Canadian National Post. It's by Jamie Sarkonak. And as she puts it, the United States under President Donald Trump is embracing protectionism, pulling back from international commitments, and spurning longtime allies, reducing overall the American footprint on the earth. No longer is America interested in administering its empire. Like the progressive left that came before it, it's embracing decolonization, just with a right-wing bent. So I'm going to turn to Alsan first. This is a twist to the concept of decolonization. I think it's fascinating. And I'd like us to dig into it a bit. How does the time of President Trump, quote unquote, change the conversation about decolonizing education and training in the context of humanitarian health? What are the implications, of this change? Please go ahead, Alsan, and start us off.
Thank you, Chichi. This is a quite interesting excerpt. However, framing it as a right-wing decolonization is misleading. For decades, the humanitarian system was shaped by the neo-colonial dynamics, and while it's not an overt colonialism, it retained the same elements and principle of domination and exclusion by other means like economic, political, and cultural. But there is also this hiding cover, which is a soft and cover of aid and development programs that usually foster the dependency of the community served. But we also have not to forget that these programs has some positive, and some of them also have some transformative like impact. For example, investment in scholarship, in education for Global South students maybe cannot be measured, but it really has some transformative impact. Also, another training program that let's say for example, the epidemiology field program for the local health worker, it shows its values during the COVID pandemic as well and other pandemics. However, during such a crisis of cutting the fund and the shrinkage, the first thing is to be deprioritized usually is the education and training program. Because it's not being considered as a life-saving or essential. And actually, this is a bit colonial mentality because they frame the education as a luxury and not something is essential. But if we really want to talk about decolonization, we need to I mean, education, and we need to empower people, and this will not happen without education and training. So, I mean, cutting aid and calling elaboration is not decolonization. And actually, training and education need investment, and decolonization must be a deliberate, intentional act. It must be giving a space for the local actor and voices, but also supporting them
Interesting.
to the decolonization process. So I probably stop here and then maybe
Sure. No, thank you for those interventions, for starting us off on this question. Sabina, do you want to come in here and share your perspectives on this?
Yeah, so I'm giving a perspective from sitting in Bangladesh and working with we work with climate affected migrants, urban slum, forced migration, and also humanitarian. We're one of the largest Rohingya camps in the world in Bangladesh. So putting into perspective what Nicholas shared and Ausan, a couple of points. I think obviously there's challenges. There's a whole kind of impact on many countries around the world. Having said that, in Bangladesh, and now that I realize, when I came back to Bangladesh in my 20s, I worked for BRAC, which is one of the largest Southern-led NGOs in the world, right? So there was always a decolonizing in practice there, because the founder of BRAC is locally led, and it was all community-based thinking and learning. So it's about thinking about what can we think through in terms of communities and practices and indigenous models that exist for education and training. Nicholas alluded to it in terms of there's a lot of cultural, rich, traditional knowledge which is useful and legitimate in public health, but tends to be sidelined because of the dominance of biomedicine in the North, in the South. And another point to this is that I think for me, if I look at BRAC or Grameen, I mean, our current state of the government won the Nobel Prize because he came up with a locally innovative solution on microfinance for women in villages. So decolonizing has been going on. We've now used a term, and now we're saying in the time of Trump, but before that, it's been going on in various ways. Having said that, we're still dependent on foreign aid and global aid, which means that, does that mean our local leaders need to start investing into resources? Because I don't see it as so black and white. I do believe there's a colonial legacy, as Nicholas pointed out so clearly and well, but a lot of my work is done in partnership. So I have forged, and I know colleagues, we've forged collaborations with colleagues in Nairobi in institutions. We forged partnerships in the UK, in Europe, and even in the US, if it's equitable and meaningful, where knowledge hierarchies are dismantled, where we have discussions around what works well for the communities we seek to serve, when we unlearn and unpack even our own prejudices, because even in the Bangladesh context, not to make it more complex, but you have, there's a lot of writing about parachute researchers coming in from other places. We have domestic researchers or parachuting in and out of field visits and not really understanding community. So I think it's about going back to basics. We want to really work with in the humanitarian sector, notwithstanding the drying up of resources, which means investment. It means looking at strategies of how do we transition better? How do we have more government commitment? How do we have allyship, which Nicholas also talked about, and create these spaces where we continue to kind of bring in multiple forms of knowledge on what would serve best in different humanitarian places, migrants that are affected. So I think some of it's being done in a basic level. It's just not known. BRAC and Grameen is not known as widely as, let's say, an institution that's located in the North. And some people know BRAC and Grameen. I think it's about going back to basics and recognizing we have a lot to offer, but also partnerships. I don't see it as so black and white. I mean, the reality is we have to work together increasingly in critical times, finding partnerships and collaborations to work together. And if it's meaningful, if it's equitable, if it's transparent, it can happen. I am working in those kinds of partnerships. Not all of it's perfect. And I think we need to kind of reframe the way we understand and think, because this is where we're at in 2025. And yeah, that's what I think. Thank you.
No, thanks, Sabina. Those are interesting points. I think I'm still fixated on the money. You know what I mean? Because Alsan made some striking comments about how cutting aid isn't decolonization. You've asked some interesting questions about whether we're asking local leaders or local, I suppose, governments and so on and so forth to begin to, put their money where their mouths are and so on and so forth.
And
Yeah, go
just
ahead.
to say, sorry, and also, you could there geopolitics is politics. We live in a world where there'll always be politics. I'm not diluting or minimizing what's going on. I'm fully aware that many people, millions are affected. But the point is, geopolitical alliances are also important if they're speaking the same language, along with local national governments stepping up. I really think leadership is called for as well. Thank you.
Thank you. Thank you. Nicholas, I'm going to bring you in, and as I do so, I'd like to highlight or draw the attention of the panelists to the Q&A box. Feel free to take a look and begin to answer the questions in the chat. We're trying to conserve 15 to 20 minutes towards the end for us to have, some verbal interaction with the audience in the virtual room. Yes, Nicholas, any thoughts to share on this issue?
Yes, it is amazing what happened. And if you compare narrative from global north to the one from global south, messages are totally different in this Trump era. Global north actor shout, ground, and castigate Trump. They bring Trump closer to hell. I have even here call on French TV talk show to not name LCI, for those who know, calling for a coup against Trump. For us from Global South, in Africa particularly, we recognize the brutal loss of huge resources coming from different sources, mainly from USAID. But we celebrate it as a second independence of Africa. It is a real window of opportunity for decolonization, and Trump is giving Africa the fuel to accelerate the process. For us, health or education agenda is a political choice in all countries. And it is time in Africa to quit dependency and international begging to make health, education part of big national causes. We have the example of Cuba, where health and education are being made big causes. Despite US embargo, Cuba found budgetary space to make free universal health coverage and free universal education. And the results for health are here, better than the American indicator. Africa has money. The data are here. When Africa receives $1 from development industry, $7 leave Africa for the global north for various reasons. And this is well organized by Washington Consensus for those who know what it is. Trump is going to help the world put an end to this permanent swindle, this permanent coloniality. It is time for Africa, and I join Sabina on it. It is time for Africa to fostering his self-reliance, mobilizing more domestic and innovative finance. In Burkina, we try crowdfunding for industrialization. We are trying patriotic funding to fund access to basic services. It is time for Africa to execute his own program with his current human capital. What is expected from the global north is support, partnership, accompaniment, not substitution in the field. Thank you.
No, thanks a lot, Nicholas. And I know that, you've mentioned Africa in particular, but, what you say, I suppose, applies to the quote unquote broader global South. Because of how you've answered this question, I think that gives us room to skip the next question I was going to ask you, which was really going to be about, what the silver linings are, because there are silver linings, and I think that's what you've spent time talking about just now. And I think your comment is quite striking about how Trump has given us the fuel to accelerate the process of decolonization, I believe you mean. Just a reminder to our panelists to take a look at the Q&A function. Just click on it. There are some questions coming in that you can begin responding to by chat before we open up the floor. I'm going to move back to you, Almarat, because you have some very practical experience on the ground coordinating the in-zone education and training program right within a refugee camp where refugees play key leadership roles in education and training and in the decisions around this. Could you share with us what you found to be, positive, about this approach, especially, given what we've been discussing so far about decolonization?
Okay, well, maybe I should just say the first benefit is not around decolonization, but I think it's very important. Yeah, considering that educating, a refugee in a traditional university, for example, in Kenya, roughly around $10,000 per year. But now, with the model in-zone program is using, in a year we are able to reach around 1,000 students across our three hubs. So the impact is actually we are impacting many refugees. But around decolonization, I believe, as I said, our perceptions, which is of course not really only ours, but also having lived in the community, but also interacting with the community on daily basis, but also in terms of studies and their needs, we are able to actually pass on that to the university to also actually hear our thoughts, like the program that is being actually developed, or a program that is actually in need, so that we have programs that the community needs. So that has been actually been successful, and it works throughout like that. We've seen areas whereby our views were taken into consideration and the program had to be ended because actually we could see it is different, but we can also see how the learners were responding to it. It was totally different. I think that's a very direct aspect I can speak to it. But more importantly, on the community health program, we have, let me say specifically, the refugees being trained, for example, on some practical modules, and then they deliver that practicals in person in the hub. Some of the course has practical workshops. So these are people who actually are trained on these modules, so that now they deliver it practically to the refugee students themselves. So making it more decolonized, not that we have to rely from experts from outside to come and do these practical sessions. Yeah.
Well, thank you, Almarat. We have 20 minutes left. I'm going to ask the last question. I'm going to ask that we keep our responses brief because we want to interact with the audience a little bit. I did come across another article. This one was from the UgandaRadioNetwork.com, written by Mahir Balunywa. And he asks a critical question. His article focused on Africa specifically, but this really applies to the globe. I'm going to paraphrase a little. He said, how should countries prepare for the new Trump administration? He goes on to say that, this requires countries to realign their strategic thinking. I want to throw this question back to you, Sabina, Alsan, Nicholas, in that order. If you could just intervene very briefly. When it comes to education and training, how should the humanitarian health system globally prepare in the context of the new policy directions in the US? And thanks, Sabina. I see we've started answering the questions in the chat. Let's keep doing that. Go ahead.
So, I mean, it's just what I'd kind of shared that, I think it's very important to build allyship and platforms, strengthen what does it mean to work in diverse contexts? What does public health mean? In a bigger scale, I think it talks about what does this transition look like? Do we have national level strategies? Do we have strategies within the region? Have we mapped out allies and partners that speak the same language and are committed to certain ways of improving global or public health, right? And I think what's important is if we take a larger framing of, do we look outside the usual boxes of donor funding? And, I mean, I was thinking to do we look at private philanthropists? Do we look at other kind of private sector actors, including public actors who might be committed to different issues that are being affected? The reality is resources will be an issue. I think one of the issues I do think is the whole political commitment at a national level or even at a regional level to say, okay, now what are we going to do about this? So commitment also has to be very strong about how do we tackle and address some of this and how do we rework it? The reality is we're not going to be able to change some of the impact. But moving forward, we have to really put on our thinking hats and think about it. I was just typing that some of the stuff we're doing is not, resources are an issue, but sometimes we need strong commitment, political, local, national, regional, and also really, really invest in partnerships. And some of the transitional thinking needs to start taking place now, as opposed to, continuing these conversations. That's what I mean, in my limited kind of ability.
No,
That's what
absolutely.
I think is
That's really
important.
helpful. And I saw Asan nodding. Please go ahead and join the conversation, Asan.
Yeah, thank you. Thank you, Chichi, and also Sabina. I echo what she said. First, we need to decolonize the mind and dismantling the. I mean, if there is something that I would want to take from this webinar is the dismantling the mentality. Decolonizing the mentality and dismantling the ideas of legend of international expert that can go to and design solution. Also about the resources, yes, we have probably now a difficult time with the funding shrinkage, but we have the human resources and they are the most valuable. The local worker who are the backbone actually of the humanitarian system. So local leaders and also the humanitarian system must invest on them, must allow them to lead the humanitarian and developmental sector. They must to be the ones who shape the policy and train the future generation. This needs also investment in the local higher education and the professional institution to enable the locals to solve their own local needs and problem before they thinking about the international framework and accreditation. And of course, this is not like a call of isolation. I again stress what Sabina says. We need a real, authentic partnership, whether this regional or south to south or north to south. One example also. I also thanks Nicolas that he reminded us about how the Cuban system has worked by itself, but also how the Cuban medical diplomacy made a equitable partnership that not only allowed to or helped the countries to treat patients, but also help countries across Africa, Latin America, and also Middle East to build their medical education system. So we need to stress the value also of this equitable partnership that is really rooted in global solidarity.
Thank you, Asan. Nicola, I'll give you the last word on this before we go to the Q&A. Are you there, Nicola? You can unmute.
Yes. Yes, sorry. I already addressed this question above. I do not have more to add. The major bottleneck in this in our situation is financing our program, and we started really to take this challenge. And if you check, you can see African Union published this week, I think last week, a position paper on how to mobilize the resources in Africa to address our health challenge, our situation. And this can be the same thing for humanitarian part, to really reflect on how we can mobilize locally resources to launch our own program, like the one that in zone can develop now. Money from USAID will stop. It will be to mobilize locally their resources to address. And I highlight some initiative in Burkina on locally resource mobilization team. So it is up to us to really decline and make work what self-reliance in Africa means for us. Thank you.
Thank you very much. So we have about 10 minutes or so. I'm looking at the Q&A box. I see a question here about how in Nairobi's Cecil Kilbari refugee camp, I'm not sure if we mean Kibera here, refugee camp. Will the CDC clinic there be closed because of USAID defunding? Are refugees allowed to work? I'm not sure if anyone on this panel is doing work in that particular setting, but maybe you can answer from your perspective, Almarat. In Kakuma, for instance, what are you seeing as a result of USA defunding, and are refugees allowed to work?
Well, yeah, actually, the USD defunding actually brought a lot of shock and also disruption in the refugee camps. So particularly, I think we've had what you call food reduction, because of course refugees in Kakuma have been receiving food and voucher, and cash voucher. But food has actually, as of this month, I think it's been reduced to 40%. I think there was actually a protest 2 months ago about, of course, with refugees protesting that, considering that most of them are confined in a refugee camp, and then economic activities are very hard. But also specifically on health, IRC, from my knowledge, actually laid down, which is International Rescue Committee, laid down most of their department, one of which is, from my knowledge, is actually community health workers. The whole project has been stopped. I think it was also last month. So the whole department was stopped because of funding, and of course there's other departments within. So that's of course in regards to, the cut in funding. About refugees working, of course refugees can work, but of course it's not been practical, because the refugees need work permit, but that work permit has been actually problematic for refugees to get. Yes, the government says refugees will work anywhere in Kenya, but as a refugee, before an employer gives you work, they need a work permit. So that work permit is issued, by, of course, by the Department of Refugee Service in Kenya. It's not been really straightforward on how does a refugee get that. Some people did apply, but they did get a rejection. But actually, this year I can see it's like they are giving emphasis on that the process is now streamlined. You can actually get your refugee work permit, and then from there you can work. But it's not actually easy, considering, of course, from my own understanding, Kenya as a country is, of course, struggling with unemployment. So refugees as well. So it's not really easy. Yeah, people try on their own entrepreneurship, but also there are those who secure jobs on their own. But as a refugees, it's not really easy to get a job in Kenya widely.
Thank you, Almarat. I see that most of the questions in the chat have been answered, including, I suppose, the last one about which says, in a situation where humanitarian settings are largely externally supported and donor dependent, how is it possible to think of decolonizing these things? I think in some ways we've sort of responded to that, including Nicholas's comment about, how the AU, has outlined some ways in which this can be done, and how Sabina's comments around, governments, local governments, so on and so forth, also, being more committed and beginning to see themselves, as, being able to finance these things, in addition to collaborations. Please go ahead, Sabina.
No,
Go
I
ahead.
wanted to say in Bangladesh, actually, the government has supported the refugees and the Rohingya refugees. I think that the tension is like, yes, there are resource cuts, but from the beginning, the Rohingyas have been getting support and commitment from the government. I mean, we've had a government change, so it remains to be seen how that moves forward. But this is also impacted, as a lot of everyone in this thing knows, about the geopolitics and if you have, I mean, I'm not sure what the question means, but if you have equitable partnerships that are committed to serving the needs of the communities, then you can decolonize the kind of content and training you do. If we bring it all down to just resources, then yes, we have to start thinking about what's this world and what are these different countries and situations going to look like. It's going to be dire in some spaces and less so in other spaces, but in general, we have to have some transitional strategies, which means, again, looking at what kind of alliances exist and what kind of commitment. But ultimately, as Alsan said, we need a global solidarity to work with in the humanitarian sector, because the factors behind a lot of this is a much more global, right? It's not about the US, it's about conflict, it's about crisis and conflict within regions. It's also global in nature in some situations. And then you've got also climate change. You've got poverty, endemic poverty that's increased so much. It's always been there, but magnified during COVID. I mean, I think we're talking about very complex issues. I don't think there's simple solutions, but I think one of the things is going back to basics and doing what you can in your space and building those kinds of relationships and networks. That is realistically what we can try and do, at least, to stick to the principle of how do we bring voices of those who are directly affected into content, into training, into language. For me, that is upending knowledge hierarchies, even my own as a professor, challenging my own understanding of communities when communities are telling me what's important to them in public health. Yeah. Thank you.
Sure. Thank you so much. There's one more question that's come up. Nicola, could you provide the name of the AU position paper that you mentioned? And if you could, maybe you could, if you can
Yes.
find it, or you could.
Africa.
Yes, please go ahead.
Africa financing in a new area. New era.
Africa financing in a new era. Thank you.
Yes,
Thank you very
yes.
much.
Mm-hmm.
Well, we only have 5 minutes left, and I don't see any new questions. So I think I'm going to spend that 5 minutes by, first of all, thanking Anna Mateus for joining us as the executive editor of the Lancet. Thanks so much for being here with us. I'll follow that up by thanking every one of our panelists. I'm sure you'll agree with me that they're quite a vibrant group, and they've given us a lot to think about, in addition to a lot of possible solutions. You can imagine from this small group what it's been like working so far on the upcoming Lancet Commission on Health, Conflict, and Forced Displacement over the last year. It's really a testament to the fact that we are expecting to have a really exciting commission come out. I should also say that you should expect other webinars from this particular Lancet Commission. I believe the next one will be around September this year. And I guess my final word will be to thank all of you for spending this hour with us. I don't see any more questions, so I am going to say thanks again and give you back around 4 minutes of your time. Thanks so much. It's been a pleasure.
Thank you. Thanks, Chi-Chi, and
Thank you
thanks
so
to
much,
everyone in the panelists.
everyone.
Thank
Bye-bye.
you.
Bye.
Bye-bye.
Bye-bye.
Bye, everyone. Thank you.